If you are struggling with urinary incontinence, you are not alone. I see patients every month with incontinence issues and teach them ways that they can regain their confidence and their control. In this video, I'm going to teach my top 4 exercises that you can do at home to help you with your urinary incontinence. Hey everyone, I'm Kareth Dow Ferguson. I'm a physical therapist and the director of our women's health program here at EW Motion Therapy in Birmingham, Alabama. This video is all about at-home exercise, but if you are interested, grab our free Women's Health Frequently Asked Questions guide in the description below. In it, you'll learn more about your pelvic floor and how physical therapy can help you with any pelvic floor dysfunction. Hit subscribe if you're new here, and let's jump right in. First up is belly breathing, which creates the foundation for all pelvic floor work. You may wonder, why are we worried about breathing in pelvic floor therapy? But pelvic floor PT is not just pelvic floor. It's all the muscles surrounding the pelvic floor and all those that can impact the pelvic floor. Main one being your diaphragm, the muscle you use to breathe. If you're not breathing properly, that pressure in the abdomen can really affect pelvic floor. So let's get started. You're going to lie down on your back. If you need a towel or something under your head, you can go ahead and grab one. You're going to lie down, and I just want you to take a few deep breaths, and I want you to notice what you feel when you breathe. Are you feeling a lot up in your chest? Are you feeling neck and shoulders? Are you feeling belly? What I would want is you feeling very little in neck and shoulders and more in your belly. So now what I want you to do is put one hand on your belly and one hand on your chest. Look back up at the ceiling, and I want you to envision filling up the hand that's on the belly with air. So just take a couple of deep breaths, trying to find that belly breathing or diaphragm breathing, as we call it. And then exhale. My hand on my chest is very quiet. There's very little happening there. If you're having trouble finding it, you can put both hands on your ribs, just kind of right at the base of your ribs, and give a little bit of overpressure and breathe into your hands. Like you're trying to open the ribs up a little bit. Just breathing into the hands and exhale. I like to get on the floor when I do this exercise, especially at first, because it can be really difficult to find that belly breathing. I don't have any other noise, I don't have anything else going on, and I'm just focusing on filling up my belly, filling up my hand with air. And maybe do this 5 or 10 breaths. Try to get on the floor a couple times a day. Once you get really good at it, you can do it in sitting, you can do it standing while you're doing other things. Now, let's work on the classic Kegel, but let's ensure that we're doing it properly. This exercise is important because it really helps you develop a connection between your pelvic floor and the brain. I want you to imagine, before we start, your pelvic floor is a bowl. It's a bowl of muscles. And so what I want you to imagine is, with that bowl, you're trying to pull up and in, and then you're just letting that bowl almost open or split in two. So you're trying to pull up and in, and then you're really trying to let it go. Not just the activation is important, it is just as important, sometimes more important, to find that relaxation. So again, on our back, so a couple things. I have a couple of cues that tend to work for most people. So you're lying here relaxed, and I want you to think about when you walk into cold water, like really cold water. and you kind of just draw up and in, I want you to try and find that and then just totally let go. So I'm pulling up and in, and I feel a little bit of deep belly. And a lot of times for me, it helps to just kind of exhale and just relax everything. Sometimes that cue of just let your back fall into the mat can help you find that relaxation. So another cue is if you really have to pee, you really got to go, but there's no bathroom, so you have to hold. So you really, really got to go, and so what do? You kind of pull up, you're trying to hold everything in, and then when you finally find a toilet and you get to sit down and you just get to let go. That's another way to kind of find that let go. So try a few of walk into cold water. Think about when you really have to pee, but you can't, you got to hold it in, and then letting go. Again, trying to let go maybe on the exhale. That's a little bit more natural. My last cue that helps, main cue that helps is think about your sits bones. You know, when you're sitting and it gets really sore, you're on those sits bones right at the pelvis. I want you to think about drawing those sits bones together and up, and then push those sits bones back out, or just let them go. So pull those sits bones together and up. You're not clenching your glutes. That's what everybody wants to do on a Kegel. That's my number one correction. So maybe even put your hands on your glutes. When I do a Kegel, my glutes are very quiet. They're not doing anything. And letting go. It's really important as you do this, especially in the beginning, that you're in a quiet environment. You don't have anything else going on. Lying down is usually the easiest way to start. Just a few more. So whether it's walk into cold water, or trying to really hold your pee in, or finding those sits bones and pulling up and in and letting go. Whichever way works for you. And trying to do 8 to 10, really good contract. And again, it's just as important to get the relaxation. Do an 8 to 10. I like to do this one 3 or 4 times a day because it just really helps solidify that connection with the brain. If you had no idea what a Kegel was until I just showed you, check out our blog article linked below to learn more about this exercise and how it can really help strengthen your connection to your pelvic floor. Now, let's do the pelvic clock. While this exercise is technically a core exercise, your core is very important in your whole pelvic floor function. Let's lie down on our back. And I want you to imagine that your pelvis is a clock. You've got belly button at 12, pubic bone at 6, and hip bones at 3 and 9. And you got a little marble. And I put it right in the center between belly button and pubic bone. And I want you to, using deep belly, you're going to roll that marble to 12 o'clock, and then you're going to roll the marble to 6 o'clock. So while you are getting some arching and flattening of the back, it's coming from deep belly. Another cue you can think about is just right at your pubic bone. I want you to pull your pubic bone up to your belly button, and then I want you to push it away. So a few more, from 12 to 6. One more, 12 to 6. Now, let's take that marble from 3 to 9. So hip bone to hip bone. So what I imagine is I've got 2 strings going through my hip bones, and there's somebody underneath, and they're pulling one down, and then they're pulling the other one down. When I think about pulling one hip bone down, that really helps me find deep belly rather than lifting up the other side. So I'm rolling that marble from hip bone to hip bone. This exercise should be a lot of brain work. That's what most of my clients say. They really have to focus. If you're not having to focus, odds are we've missed something. So I'm just pulling one hip bone down just enough to roll that marble side to side. One more. Now let's take it all the way around the clock. So I go 12, 3, 6, 9. 12, use your hands if you need to. 3, 6, 9, and then reverse it. There's always one direction that feels easier than the other. So I'm gonna go 12, 9, 6, 3. And I feel work in my deep belly. I'm not huge on sets and reps. I just think it's good to do it till you feel like you've got the hang of it. But maybe a good 10 or 12, maybe 15 reps to each side. From your 12 to 6, your 3 to 9, and then your circles, and then your reverse circles, and maybe doing a couple of rounds of that once or twice a day. All right, you made it to our last exercise, so let's loosen up your hip flexors. Tight hip flexors can really impact your pelvic floor because if you have tight hip flexors, you have tight hips, which very much impacts your pelvic floor function. Why are we doing a hip flexor stretch when we're talking pelvic floor? Because again, it goes back to the belly breathing, it goes back to the pelvic clock. Every muscle that can impact pelvic floor needs to be addressed, not just pelvic floor. So we're gonna come up to tall kneeling, and I'm gonna put one foot in front, and I'm thinking about getting my ribs kind of over my pelvis. I'm nice and stacked. I'm thinking about maybe tucking my tailbone a little bit, and then I feel a stretch down the front of that hip. Taking maybe 5 or 6 deep breaths and really trying to relax maybe. There's a lot of relaxation in pelvic floor therapy. Relax into that stretch a little bit. I'll take one more breath and then switch sides. So my right foot is up, left leg is down, my ribs are stacked over my pelvis. I do a little bit of a tucking of my tailbone, activating that glute, and then just boom, all the way down that leg. I feel a huge stretch. Just a few deep breaths here. This one is one everyone should be doing. So even if you're not struggling with pelvic floor, do the stretch. And we all need to be doing this one throughout the day. That's why I like to hold it for 4 or 5 breaths, and I'd rather you do it 4 or 5 times throughout the day. These exercises are a solid start. Try them daily for the next 2 or 3 weeks and see how you feel. But remember, they are just the beginning of treating urinary incontinence. Most people are surprised to learn that physical therapy is actually one of the most effective treatments for urinary incontinence. You might think your only options are medications, surgery, or just living with it. But pelvic floor physical therapy is a proven, non-invasive treatment that addresses the root cause of your symptoms. A pelvic floor PT will create a safe and judgment-free environment where you can be completely honest about your symptoms. Then they will assess what might be causing your incontinence, like daily habits or triggers in your diet. Finally, they will teach you bladder retraining techniques and behavioral changes that can really improve your quality of life. Talking about incontinence can feel embarrassing, but it shouldn't be. Here at EW Motion Therapy, many of our physical therapists have advanced pelvic floor therapy certifications. Our team would love to show you how pelvic floor PT can change your life. Visit our website, linked below, to book a consult with me or another one of our specialists. We have clinics located in Tuscaloosa and all around the greater Birmingham area. You can learn more about how pelvic floor physical therapy can help incontinence in the blog article below. Thanks so much for watching the video. Give this video a thumbs up if you like the exercises, and I'll see you next time.